Hi, my name is Sarah Steinhardt. I'm an assistant professor with the College of Pharmacy and the College of Public Health. And we are here today with a Facebook Live to raise awareness for Red Ribbon Week, which is a national campaign to raise awareness to stop drug abuse and also alcohol abuse. And today I'm going to be interviewing my friend Sam Graper, and he is a community relations manager over at Orlando Immunology Center. And he comes every year to the substance abuse class here at the college to talk to the students about treatment for patients in recovery and also for HIV positive patients and how we can help them in their steps to recovery. So thank you for being with me today, Sam. And my first question for you today is, in the class today you gave a talk to the students about substance abuse, and what was your primary focus of that talk?
I would say talk about it. We've got to shatter the stigma around drinking and substance abuse. The more we talk about it, the less stigma there is, and the less stigma there is, the more people can get the help that they need. And there is a lot of help out there.
And also, if people have a family member or a friend who has substance abuse issues, what's the best way to approach them, that they would be receptive to receive support?
It's a complicated issue, but I think, for the most part, greeting somebody with love and trying to understand where they're coming from, creating a safe environment for them so that they feel comfortable talking to you. There are a lot of different resources out there. There are 12-step fellowships like Alcoholics Anonymous and Narcotics Anonymous. Both of those are free. Anybody that's listening can find those because they're worldwide fellowships. In addition to that, there are also some different online resources for counseling, therapy, other different modalities of treatment for substance abuse.
And what would you see as the best way that healthcare professionals can help patients who are in recovery?
Well, I think it's a great question because we're the ones that are at the forefront, and we see patients on a regular basis and see some of these different things, but don't really know how to address them. And there are actually guidelines within CDC and HRSA that medical professionals can follow. Part of them are, just being culturally sensitive. In other words, understand that not all of us have the same life experiences. And as long as we greet all of our patients with that type of openness and create a safe harbor for them, not only are they going to tell us exactly what's going on, but it's actually going to produce better outcomes in the long run because you're getting an honest response from your patient. So you're not treating the symptoms, you're actually treating the disease. Anybody can stop using if they have the desire. That is the number one thing. They have to be willing. And here's the thing is no one of us can judge how willing or what that desire is within that other person. So if somebody is looking for help, even if it is their second or third time, whether they are 19 or 75, do the things that are necessary to get them, the treatment that they need. Because at the end of the day, there is hope. And I've been to plenty of meetings where I've seen people who are both 19, 45, 75 come in and find a new way to live. And I think that that's really what we're talking about. Pharmacists play a critical role in healthcare, and there are many times where pharmacists probably don't understand how critical a role that they can play. And the reason why I know that is because I've been an HIV case manager before and worked with hundreds of people. And pharmacists are in a unique position because they get to see the person sometimes 12 times a year, and a doctor might see them once or twice. So the message is that when we're talking about creating safe environments, making sure that we do that with intentionality. Even if we are, at a corner pharmacy or in a research facility or moving through our life and doing other things, if we're that one person that the individual feels comfortable talking to as a pharmacist, you can then get them linked to the resources that they need. Once again, you're providing them that safe harbor, but you're going to be actually getting better medical outcomes in the long run, wondering why they're not picking up medications and then coming in and getting them all at once. You won't have those questions because you'll actually know.